Welcome back to my YouTube channel. If you are new to my channel, welcome to Medicalcoding Insight. Hi, I am Nishaba, a certified medical coder. In the previous video, we discussed the emergency department, different types of code related to critical care and newborn care services along with their guidelines. In this video, we will cover coding practice to help you to better understand these concepts. A 20-day-old infant was seen in the emergency room by the neonatologist admitting the baby to the neonatal intensive care unit for cyanosis and rapid breathing. The neonatologist performed intubation, ventilation management, and complete echocardiogram in the neonatal intensive care unit and provided a report for the echocardiography, which did indicate congenital heart disease. Select the correct course for the physician service. Option A with the code 99,468 along with modifier 25, 93,303 along with modifier 26. Option B with the code 99,471 along with modifier 25, 31,500, 94,002, 93,303 along with modifier 26. Option C with the code 99,460 along with modified 25, 31,500, 94,002, 93,303 along with modified 26. Option D with the code 99,291 along with modified 25, 93,303 along with modified 26. In the given scenario, the infant, after being seen in the emergency department, is admitted to neonatal intensive care unit, which means critical care services are provided in both the outpatient and inpatient setting. Since these occur on the same day with the same physician, we must follow the CPT subsection guidelines under the inpatient, neonatal, and pediatric critical care. According to these guidelines, if the same individual provides critical care services for the neonatal or pediatric patient in both the outpatient and inpatient setting on the same day, report only the appropriate neonatal or pediatric inpatient critical care service code 99,468 to 99,472 for all critical care services provided on that day. On the basis of this guideline, we will first eliminate option C, which include code 99,460, which is used for initial hospital or birth center care per day for the evaluation and management of a normal newborn infant. And option D, which include code 99,291, which is used for outpatient critical care services. The baby is 20 days old and receiving intubation and ventilation management. Both services are included in the neonatal and pediatric critical care course, so we cannot code them separately. Therefore, we will also eliminate option B with the code 31,500 used for intubation and 94,002 used for ventilation management, as it is already covered under the neonatal and pediatric critical care course. So the correct option is option A, which include code 99,468, which is used for initial inpatient neonatal critical care per day for the evaluation and management of critical ill neonates 28 days of age or younger, as well as the code 93,303, which is used for thoracic complete echocardiography for the congenital heart disease. Modifier 26 is used for the professional service. A premature baby is born at 26 weeks of gestation and admitted to the neonatal intensive care unit due to respiratory distress and low birth weight. Dr. Adams, a neonatologist, provide daily management and monitoring for the baby, including ventilator support, total parental nutrition, and other necessary intervention. What CPT code should be used for Dr. Adams' initial inpatient neonatal intensive care services for the baby? Option A with the code 99,468. Option B with the code 99,477. Option C with the code 99,478. Option D with the code 99,479. In this scenario, a premature baby is admitted to neonatal intensive care unit due to respiratory distress and low birth weight. For neonatal intensive care unit, we use the code range 99,477 to 99,480. We will first eliminate option A with the code 99,468, which is used for initial inpatient neonatal critical care per day for the evolution and management of critically ill neonate 28 days of age or younger. As patient received initial inpatient neonatal intensive care services, we will also eliminate option C and D with the code 99,478 and 99,479 is both used for subsequent intensive care. Code 99,477 is used for initial hospital care per day for the evaluation and management of neonate of 28 days of age or younger who requires intensive observation, frequent intervention, and other intensive care services. Dr. Sam was called to the critical care burn unit to see 50-year-old patient who suffered third-degree burns to 30% of her body. Dr. Sam spent 2 hours and 40 minutes with this patient, her family, and coordinating care with other specialists. He made several phone calls from the unit on her behalf and consulted with the nursing staff. During this time, Dr. Sam provided ventilator management and gastric intubation. What code correctly captured Dr. Sam's services? Option A with the code 43,752, 99,291, and 99,292 into 3. Option B with the code 99,291 and 99,292 into 3. Option C with the code 99,291 and 99,292 into 2. Option D with the code 43,753, 99,291 and 99,292 into 3. In the given scenario, the patient is receiving services in the critical care burn unit where the doctor spent 2 hours and 40 minutes with the patient providing ventilator management and gastric intubation. We first eliminate option A and D is code 43,752 and 43,753, both used for gastric intubation, is already included in the critical care service. Therefore, it cannot be used in conjunction with code 99,291. Since the doctor spent 2 hours and 40 minutes with this patient, we will use the table in the CPT book on page number 25 to select the correct code based on the time. Code 99,291 with 2 units of 99,292 is used when the time range is 1 hour and 45 minutes to 2 hours and 14 minutes. Code 99,291 with 3 units of 99,292 is used when the time range is 2 hours 15 minutes to 2 hours 44 minutes, which include the time of the 2 hours and 40 minutes as mentioned in the scenario. So our correct option is option B with the code 99,291 and 99,292 into 3. A 20-month-old child is admitted to the hospital with pneumonia and acute respiratory distress. The physician spent 3 minutes intubating the child and spent 90 minutes of critical care time stabilizing the patient. Option A with the code 99,291, 99,292 along with modified 25, 31,500. Option B with the code 99,471 along with modified 25, 31,500. Option C with the code 99,291 along with modified 25, 99,292 along with modified 25, 31,500. Option D with the code 99,471. A 20-month-old child is admitted to the hospital with pneumonia and acute respiratory distress, means inpatient critical care services are provided. We will first eliminate option A and C as code 99,291 is used for outpatient critical care services. We will also eliminate option B. S code 31500 is used for endotracheal intubation, which is already included in the pediatric or neonatal critical care service code 99468 to 99476. Our correct option is option D with the code 99471, which is used for initial inpatient pediatric critical care per day for the evaluation and management of critical in infant or young child 29 days through 24 months of age. The patient is a 36-year-old male who presents to the emergency department after several hours of low back pain, nausea, and chills. The emergency department physician takes a detailed history and performs a comprehensive examination. A urinalysis lab and CT scan of the abdomen is ordered. The result of the CT scan shows two small kidney stones. The emergency department physician discusses the result with the patient and tells him the stones are small and will pass on their own. Medical decision making of moderate complexity is made with the patient being discharged with the prescription of pain medication and with diagnosis of kidney stones. Select the evaluation and management code and diagnosis codes. Option A 99,285 and 20.0 M 54.5 R 11.2 R 68.83. Option B with the code 99,284 M 54.5 R 11.2 R 68.83 and N 20.0. Option C with the code 99,283 and 20.0. Option D with the code 99284 and N20.0. The patient was diagnosed with the kidney stone with the medical decision making of the moderate level and discharged with a prescription of pain medication. Based on the medical decision making, we will first eliminate option A, which include code 99285 for the emergency department visit with the high level of medical decision making. We will also eliminate option C, which include code 99283, which is used for the emergency department visit with a low level of medical decision making. Both option A and D include code 99284, which is used for emergency department visit, which require a medically appropriate history and our examination and a moderate level of medical decision making. The diagnosis is kidney stones as indicated by ICD code and 20.0. Back pain, nausea, and chills are symptoms of kidney stone. According to ICD-10-CM guidelines, signs and symptoms that are routinely associated with the disease process should not be assigned as additional code. Therefore, low back pain, nausea, and chills are not reported separately. Based on this guideline, we will also eliminate option B, which include diagnosis code for the symptoms along with related disease. So, a correct option is option D with the code 99284 and N20.0. A 2-year-old patient Sam is diagnosed with severe pneumonia and requires specialized care at pediatric hospital. Dr. Miller, a pediatric critical care specialist, accompanies Sam during her transport by ambulance from local hospital to pediatric hospital. Dr. Miller provides continuous care and monitoring during the 45 minutes transport. What CPT code should be used for the Dr. Miller Pediatric Critical Care Patient Transport Services? Option A with the code 99291, Option B with the code 99466, Option C with the code 99466 and 99467, Option D with the code 99485. To provide the Dr. Miller Pediatric Critical Care Patient Transport Service, we first eliminate option A with the code 99291, which is used for the critical care evolution and management. All remaining options have code used to report critical care face-to-face services or not face-to-face supervision during an interfacility transport of critical ill or critical injured pediatric patient. As Dr. Miller, a pediatric critical care specialist, accompanies Sam during her transport by ambulance. Therefore, we will eliminate option D, which is used for non face to face supervision. Both option B and C are used to report the physical attendance and direct face to face care by the physician during the interfaculty transport of a critical ill or critically injured pediatric patient. In the given scenario, the Dr. Miller provides continuous care and monitoring during the 45 minutes of transport. We will also eliminate option C because the code 99,466 is used for the first 30 to 74 minutes. For each additional 30 minutes, the add-on code 99,467 should be reported. Therefore, the correct option is option B with the code 99,466. At the request of Mother's Obstetrician, a neonatologist is called to attend the birth of an infant being delivered at 29th-week gestation. During delivery, the neonate was pale and brachycardic, needing resuscitation. Neonatologist performed the suctioning and bag ventilation on this 1,000-gram neonate was performed with 100% oxygen. Brachycardia worsened, requiring endotracheal intubation and insertion of umbilical line for fluid resuscitation. Later, this critically ill neonate was moved from the delivery room and admitted to the neonate intensive care unit with severe respiratory distress and continued hypotension. What are the appropriate procedure code reported by the neonatologist? Option A with the code 99,465 and 99,468. Option B with the code 99,465, 99,464, 99,468, along with modified 25, 31,500, along with modified 59, 36,510, along with modified 59. Option C with the code 99,468, 99,464. Option D with the code 99,465, 99,468 along with modified 25, 31,500 along with modified 59 and 36,510 along with modified 59. In this scenario, the neonatologist resuscitates a newborn who is brachycardic and in need of resuscitation, performing suctioning and bag ventilation. First, we will eliminate option B as we can't report delivery room attendant services in conjunction with delivery room resuscitation services. In the given scenario, the provider resuscitates a newborn in the delivery room. We will also eliminate option C as the code 99,464 is used only for the attendance at the delivery and initial stabilization of the newborn. In this scenario, in the delivery room, endotracheal intubation and insertion of umbilical line for fluid resuscitation are performed. We will follow the guideline to eliminate option A. As these procedures, which are performed as a necessary part of the resuscitation and not as a convenience before admission to the neonatal intensive care unit, are reported separately in addition to code 99,465. Our correct option is option D with the code 99,465, 99,468 along with modified 25, 31,500 along with modified 59 and 36,510 along with modified 59. Modified 59 is appended to indicate that these procedures were performed before the baby was admitted to neonatal intensive care unit. Modified 25 is reported to indicate a separate and significant evolution and management service. A baby boy was evaluated at the birthing center on the morning of his birth. The documentation noted a comprehensive examination along with the maternal, fetal, and newborn history. The decision making for discharge was straightforward. Documentation revealed a normal newborn, and the decision was made to discharge the baby later that same day. How should you report this service? Option A with the code 99,463. Option B with the code 99,460 along with modified 25, 99,463. Option C with the code 99,238. Option D with the code 99234. As the baby boy was evaluated at the birthing center on the morning of his birth and documentation revealed a normal newborn, for evaluation and management services for the newborn, we use code 99460 to 99463. We first eliminate option C, which include code 99238, which is used for the newborn hospital discharge services provided on the date subsequent to the admission date. We will also eliminate option D, which include code 99234, which is used for the hospital inpatient or observation care services for the evaluation and management of a patient, including admission and discharge on the same day. We will eliminate option B because the code 99460 is for the initial hospital or birthing center care, which is already included in the code 99463, which is used for the initial hospital or birthing center care per day for the evaluation and management of normal newborn infant admitted and discharged on the same date. So our correct option is option A with the code 99463. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.